ballpark, how much of that 10 billion is needed for the 7-day NHS?
We haven't separated it out in that way.
So, for example, if you didn't do the 7-day contracts that are potentially being imposed, I'm just interested in how much you think you would save.
For the junior doctors' contracts, we're not changing the overall envelope of pay.
No, but if they're working more weekends, presumably there's somebody else who's having to cover, if you've got the same number of doctors, shifts and rotas. You said the 10 billion covers the 7-day NHS. I just wanted to know, when you've told me, I think the answer.
Yes, it is.
There isn't a... But you
there is no separate pot
No.
that we've set aside for something with the specific label of 7 days.
Doesn't give a great feeling of warmth that you understand the implications of the policy in terms of manpower. What is the delta in man and women power that you need in order to meet the 7-day NHS?
I wish it was a question that could be answered in a simple way, in a mechanical way.
If you don't know the answer for the whole NHS approximately, I understand you have to work it through in detail, but if you don't know in broad terms what that answer is, I mean, how can you be doing the policy? You're the guys that are sitting above all of these trusts, and I'm just kind of surprised that you can put this policy into place without having some idea of the implication for staffing levels.
So that's a big part of the reason why the planning guidance in December asked local footprints to create their own sustainable transformation plans that brought together all of those
issues.
So
what if the answer comes back as being more than £10 billion then?
There is no readily accessible data on vacancy rate. There's limited data on course completion rates. There's limited data on leaver rates, and there's no inclusion of information on staff employed by agency for temporary staff. So you don't know, do you?
So the report rightly identifies that there are some data gaps within our workforce planning.
That's generous.
I have to say the lack of data, as Karen Smith has rightly highlighted, really worried us before the hearing, and I'm not sure that we're convinced by the answers that you can do your job without that data. But I'm going to bring Chris Evans in for a quick fire, and I've got a few more points in the last
Just a quick piece of information. I've just had a news text here that says the BMA have announced further 3 days for industrial action. How is the 10-day service going to work in light of this, especially with junior doctors leaving?
Well, obviously that news has come in since we've been sat here today.
Given you've acknowledged you don't have the data, and you freely acknowledge that, it is interesting that the Secretary of State and the department went out and imposed a contract on junior doctors when there are real gaps in your long-term planning for staffing.
Well,
seems like you're flying blind.